Assalamu alaikum warahmatullahi wabarakatuh. I'm Dr. Mir Ahmed. I'm a general practitioner, general physician, diabetologist, and infectious disease specialist from Medicare Clinic Soil 1920 in HSR Layout, Bangalore. And today I'm going to talk to you about a group of patients who have had the opportunity to work in three different states of India or three different regions of the world. For example, let us take the example of somebody who has worked for a few years in Goa, a few years in Karnataka, and a few years in Tamil Nadu. Now, what we are going to talk about is when these patients develop illness and land up in the ICU, the mortality and morbidity rate for these patients is extremely high. Why is it that these patients who have worked in three different regions or states have a far higher morbidity and mortality than those people who have worked only in a single region or a single state? The reason is very simple, because when these people work in different regions, like for example in Goa, the work protocol that is presented to them is accepted as the norm or the normal. As soon as they land in Karnataka, the whole work protocol changes, and the way they are expected to work is very different, and they try to adapt and change. And finally, when they finish their term in Karnataka and go to Tamil Nadu, the protocol and the method of working is quite different from what it is in these two states. So finally, when they develop a medical problem and land in the ICU, they realize that when all the service record is interpreted, and the barrage of questions that come at them, they cannot are no longer considered as normal and the norm and the practice when they are trying to present their history in the ICU in Tamil Nadu. So what happens is the interpretation is different, and the protocol starts applying itself in a different manner, and this leads to a condition where they start deteriorating and collapsing rapidly, leading to a point where they can no longer support their life and they collapse and die. Although this seems like a very, very complex problem involving different regions, we have to realize that this is a very concealed program that is designed to eliminate these people in these cohort. There is a concealed unity despite of the diversity, but it works against the patient, while the patient is made a complete joker, comedian, and humor artist. Kindly stop others from becoming jokers, comedians, and humor artists. Jazakallah khair.